Do you know what endometriosis is? Well, here's a little bit of information about endometriosis. Let's start out with the definition of endometriosis. Endometriosis is a painful disorder inside your uterus, which the lining of your uterus grows outside your uterus. Endometriosis most commonly involves your ovaries, bowels, or tissues lining your pelvis. It is very rare that it grows beyond your pelvic region. Endometriosis displays endometrial tissue continues to act as it normally would. It thickens, breaks down, and bleeds with each menstrual cycle. Because this displaced tissue has no way to exit your body, it becomes trapped. When endometriosis involves the ovaries, cysts called endometriomas may form. Surrounding tissue can be irritated, eventually developing scar tissue and adhesions. Abnormal tissue that binds your organs together. Endometriosis can cause pains, sometimes severe, especially during your period. Fertility problems also may develop. Now that you know what endometriosis is, let's go on to the symptoms. Most women have severe pain during periods, also pain during intercourse. One of the main symptoms that women have trouble dealing with is infertility. Other symptoms that come with endometriosis is diarrhea, constipation, bloating, or nausea. Not all pelvic pain is caused by endometriosis. Endometriosis is sometimes mistaken for other conditions that cause pelvic pain, such as pelvic inflammatory disease or ovarian cyst. Also, irritable bowel syndrome. To diagnose endometriosis, your doctor will ask you about your symptoms, including where your pain is located. Some tests to check your physical clues of endometriosis is a pelvic exam, which your doctor manually feels around your pelvis area for abnormalities. Then, once the doctor feels that you have abnormalities in your pelvis, he will order an ultrasound, which can be a normal ultrasound or a transvaginal ultrasound. Once you have been diagnosed with endometriosis, you should know how it's caused. Endometriosis is probably caused by retrograde menstruation. Retrograde menstruation is menstrual blood containing endometrial cells flow back through the fallopian tubes and into the pelvic cavity inside of your body. Endometriosis has risk factors just as any medical condition that prevents the normal passage of menstrual flows out of the body. Also, pelvic infections. Along with the risk factors are also complications. The main complication of endometriosis is impaired fertility. The endometriosis can obstruct the tubes and keep the egg and sperm from uniting. Overall lifetime risk can be ovarian cancer, but it is very low risk to begin with. Some studies suggest that endometriosis increases that risk, but still is relatively low. Here are some ways that endometriosis is treated. Treatment for endometriosis is usually with medication or surgery. The approach you and your doctor choose will depend on the severity of your signs and symptoms and whether you hope to get pregnant or not. Generally, doctors recommend trying conservative treatment approaches first, opting for surgery as a last resort. Your doctor may recommend that you take over-the-counter pain relievers, such as anti-inflammatory drugs, ibuprofen, or naproxen, to help ease painful menstrual cramps. However, if you find that taking the maximum dose doesn't provide full relief, you may need to try another approach to manage your signs and symptoms. Supplemental hormones are sometimes effective in reducing or eliminating the pain of endometriosis. That's because the risk and fall of hormones during the menstrual cycle causes endometrial implants to thicken, break down, and bleed. Hormone medication may slow the growth and prevent new implants of endometrial tissue. However, hormone therapy isn't a permanent fix for endometriosis. Endometriosis is commonly found in women in their mid-20s, but some women find it earlier than that. Endometriosis is different in every single woman, so always keep that in mind.